In the wake of UMass Memorial Healthcare deciding to close the Plumley Village Health Clinic, City Councilor Soraya Rivera holds a standing committee meeting Wednesday night. The request filed by Rivera is asking the city manager to work with the hospital to address the many issues rising with the closing. Our Brittany Schaefer was at the meeting. She joins us now live with more. Brittany?
Anna, the main issue for patients is finding a primary care physician. Rivera says many of the patients don't speak English, and finding a new doctor has been difficult.
This is a loss for us as a city.
In less than 2 weeks, the Plumley Village Health Clinic will close permanently, and for patients like Patricia Price, it hasn't been easy.
I've been seeing my doctor over there more than 20 years, and for me to have to go find somebody new, it's traumatic.
District 4 City Councilor Soraya Rivera held a City Council Standing Committee on Health and Human Services meeting Wednesday night. During the meeting, an employee at the Plumley Village Apartments says many of the doctors recommended by UMass Memorial are not accepting patients.
I probably got maybe, 12 or 15 deep into the doctors and still couldn't find anybody who was accepting.
If that becomes a challenge, what are we doing to address the challenges, and how are we working together collaboratively to make sure that the patients have adequate, equitable care? That's the most important thing.
The sudden closing of the UMass Memorial office will leave 2,000 patients looking for a new primary care physician. The Plumley Clinic Coalition says half of the patients speak little to no English.
The doctors who work there and the whole staff I could understand them, speak to them in their language, and followed up with them. They would make sure that they understood. They'd call them at home.
Price says another big problem is many of the suggested doctors don't have offices in Worcester, and traveling isn't an option for many patients.
I want UMass to put them over at the hospital where they were supposed to go in the first place. Put the team back together and keep them there. That way the patients don't have to scatter and they don't have to stress about finding another physician. I was stressed.
Rivera says the goal of the meeting is to help the patients' transitions go as easy as possible.
What's important that we as a community and we as a city are never afraid to come to the table collectively to try to come up with solutions that's going to better our community, even if they're difficult conversations.
During the meeting, Rivera was taking down questions to ask UMass in the next few days. As for Price, she did find a new doctor through a referral. Brittany Schaefer, Worcester News Tonight.